Broadcasting from Silicon Valley, California, this is Conversations with Jennylyn.
Okay. Thank you for watching Conversations with Jennylyn. And today I am bringing you a guest that I've had on my show twice before, but he has so much information to share with us that can benefit us, especially during this time of the pandemic, that I decided to do a series with him so he can continue weekly to provide us with tips to help to protect ourselves against the coronavirus. So today, my guest is Dr. Ying Qiu Wang, and he is the founder and honored president of the University of East-West Medicine. Dr. Wang, welcome and thanks again for coming back to share more information with us.
Okay, thank you, Jenny, and welcome and thanks everybody. Today we are together share how about the lower back problem. Many people have lower back problem, lower back pain, leg pain. Also, if lower back pain and leg pain, usually your kidney energy weak. If your kidney energy weak, usually can make your whole body antibody energy weak. Immunity will be weak. So not just for the lower back and the leg stronger, also for prevent virus also is important. Yeah,
so you're
today,
saying that if you're having problems with your lower back, that will affect and make your kidney weak. And if your kidney is not functioning right, it will cause lower back pain and it can make you more susceptible to contracting the coronavirus.
yes,
Okay.
right, you got it. Okay, about lower back pain, I believe 100% people have this kind of problem because lower back usually have the vertebrae lumbar one, first, second, third, and fourth, and five. Usually lumbar have 5 vertebrae. So most of the AV people are damaged, especially after 30 years old, 100%. And before 30 years old, I think it's usually 90 or 95% the people damage lumbar, make you lower back pain and leg pain.
So you're saying when you damage the lower back, the lumbar 1 and 5,
yes,
you can have lower back pain.
yes.
Okay.
Of course, usually S1, the 2, S3, usually damage with the lumbar. So, okay. Yeah, lower back have bigger area. So damage is very easy. The main University East-West Medicine Medical Center, special with another the kind of doctor difference. This especially me, 40 years research, I found the lower, the lumbar 1 to 5 and the S 1, 2, 3, 4 all have gaps. Okay, this is my special.
That's your special. Your special is the lower back, lumbars 1 through 5. This is your specialty.
Yes.
Okay.
Yes, I'm specialty. What is special? Special, that means I find the leg and the lower back and bladder, intestine, kidney, ladies' organs, gentlemen organs, all have the gates control. You get close, the people a lot of problem.
Can I stop you for a second? I'm so sorry. You're saying the gates to the kidneys, women's organs, men's organs are all in that part of the body. And if the gates to those organs get closed, they have problems. And your specialty is opening those gates. Is that
true?
correct?
Yeah, that's right.
Okay.
Yes. Okay. Lower back is very important according to Chinese medicine theory and clinic practice, because lower back is a kidney in there. Chinese medicine believe if kidney weak, whole body, all the energy will be weak.
Okay.
So your antibody and sleep and every kind of problem appear. So today discuss lower back, and the lower back, the gate is very important.
Okay. It's very important to keep, I'm just repeating it for the viewers. It's very important in order to enjoy good health, healthy kidneys, intestines, female and male organs, to keep your lower back gates open.
That's right. Okay, if you want to get the strong body, strong energy, and a high level intelligence, and do everything you can have good control, you must kidney energy strong. Kidney energy strong must be your lower gates open. That is very important.
So to keep the kidney gates strong, to keep the kidney healthy, it's important to keep the kidney gates open.
Yes, you are right. Okay, usually what kind of body health problem you should be think about your lower gates. Okay, lower gates usually make you the lower back pain, sore, and weak, and usually make you leg pain, the sciatica, numbness, and the walk is difficult.
So
okay, many people.
Are you saying that if someone is suffering from sciatica, that if they open their back gates, it can resolve that problem? Is that what you're saying?
Yes, yes. Okay,
Really?
usually if you have the urine problem, especially some people is the after 50 years old, their cough usually make urine out. Okay, and also you are the urine cannot control. Many people is in the evening get up, go to the bathroom, urine 3 times, 4 times or more.
During
That
the
means in the night. But as you know, if people in the evening get up, go to bathroom 3 times or 4 times, whole night, no good sleep. Second day, is very tired. Okay, this is for kidney, the urine, the bladder. And also, if lower get close, usually make you ladies the organs problem, 6 organs problem, pregnant problem. Yes, okay. Usually make the lady and the gentleman the organs are weak. So many people is not pregnant. If pregnant, usually the baby is not very healthy. So that's why.
Can I repeat that? You're saying if the woman is pregnant and the kidney gates are not functioning properly, it's closed, it would affect the baby.
Yes.
It would affect the fetus.
Yes.
Okay.
Yes. This kind of problem have a lot people. If children have their baby have problem, you should be think about how to open you the ladies' genital gates. You can get very healthy, very smart baby. Especially some people long time not pregnant. Okay, you should be checking your gates. If some people is the monthly pain, lady, is the not regular, not is abnormal, or mostly many ladies think about about the 85%. In my clinic, ladies have monthly they are not normal pain, and they are heavy, and earlier or later, or a lot blood, or little bit. Okay, a lot of ladies, their monthly problem appear. Also, gentlemen, if you have sexual function weak and disorder, or they have their big problem, usually should be check your gates first, because the gates control there. If gates open, circulation immediately going to the organs, and the function is come back normal.
So let me repeat that, because in case somebody's having trouble hearing you, I'm not trying to be rude, I'm just making sure that it's clear what you're saying. You're saying a man who has erectile dysfunction, it's not necessary, it could be because his gate is closed.
Closed.
And if you can open that gate for him, he wouldn't need Viagra and his dysfunction will be corrected. Is that correct?
Yes, that's right. My means mostly 95% gentlemen and the ladies, the gates, man or woman, the gates will get closed.
Is that because of childbirth? Can childbirth cause the gates to close on a woman?
Yes, yes, okay. Yeah. Okay. So many people, they don't know. They just check Western medicine, they don't know. Everybody have their gates,
okay.
rural gates.
Okay.
Chinese medicine, we don't know they have the gates in the lower back. So this big problem today, I would like to say, I have 40 years more research. I find if gates closed or open, the people sleep good and even needn't get up, go to bathroom 3 or 5 times. They can get good sleep.
Dr. Wang, can I
yes,
ask you a question?
great.
And I'm asking this because I think a lot of people might have the same question. Why is it that these gates and the knowledge of the gates, information about these gates and keeping them open for healthier functioning organs and a healthier, happier body, why is it that we haven't been receiving more information about the importance of these gates and keeping them open?
Yes, this is a very good question. And every people, they are very take care these parts and very want to know how to keep the gates open. According to my research, long time in clinic, I find nobody avoiding the gates closed. Just some people big clothes, some people small clothes, or they are several clothes or related clothes. Just the difference. But the gates close, I believe 100% people cannot avoid it. So they are this is because they are damaged, their position, and their weak body, and also inherited, and also some code when they are to your lower back, make you lower gets closed.
So you've been treating me for a back problem that I have. And it's amazing what you're saying about these gates. I know anyone listening to you will be thinking, they can't get it. But I know from experience, because you are treating me, that it's true. When the gates are open, your life is so different. And I feel that if more people have this knowledge about the importance of keeping their gates open, we will have a lot happier, healthier nation. I guess the question that keeps coming back to me, why are you the only doctor talking about these gates? I'm sure there are other doctors out there talking about it, but before I met you, I came to you because I had a back injury at work. And it's continued to cause me problems, and I came to you for help. And you told me about the gates, and you've since made a huge difference, and I'm still being treated. But I have seen so many other doctors for, since I got this injury, but no one else has ever mentioned the gates. And so I'm wondering why? Because you didn't have to use any needles, any medication. You used your fingers and some acupuncture. So needles in terms of acupuncture, but you've made a humongous difference in my life. Why is it that more doctors are not incorporating this method of treatment when they are helping patients with similar problems, is what I'm trying to find out.
Yeah, okay. If you look at their clothes, as me, okay, I think 20 years ago, I used a lot X-ray and MRI.
Yes.
And fMRI, I do a lot test. After I check, oh, these people get close. I should have evidence. That is laboratory, X-ray, MRI. They told me, oh, my touch diagnosis is right.
Wow, I want to say that again. I want to say that. I want to make sure people don't miss this. You said in the past 20 years ago, you used a lot of x-rays and a lot of MRIs to help in your diagnostics. But then you started to research the gates and opening them. And as you became more informed and you learned more about these gates, you discovered you make a better diagnosis using your fingers.
Yeah.
And I know that is true because that's what you did with me, just your fingers. And that is what I find fascinating about what you're doing. So please share more with us. I just wanted to make sure people heard that.
Yeah, before is treated the lower back problem. Also many internal organs and the leg, lower back problem from their lower gates. Before I must be use the laboratory, some laboratory testing and X-ray. But right now, I needn't. I use my hands. According to the patient, they talk me what problem they have. Follow the talk. I can use my hands immediately check. I can get information. I can touch. I can know which gets close. How many percent close? I very clearly.
That is amazing. That is amazing. So someone comes to you, they tell you their complaint, you take them in a room, you take your fingers and you do an evaluation. And from that, you can immediately determine where the problem is and how you need to fix it.
Yeah, usually
always,
also.
Or is there a time? Is this always how you can tell, or do you still need to send patients sometimes for x-rays or MRIs?
Right now, I needn't that one because acupuncture or medicine doctor, no X-ray. But right now, I just use my hands, and they are also combined with the patient's symptoms. I can very clear the diagnosis, and usually use my hands, follow my diagnosis. I do acupuncture, herbs, hard pack, and hands work. Patient usually immediately feeling difference. That means my diagnosis is right.
Amazing.
Also, the treatment, the way is work for patient.
I just have to say that if I were someone just listening to you, I would have such a hard time wrapping my head around what you're saying. But I have been a recipient of this treatment and I know it works. I am so happy, Dr. Wang, that you learned how to do this. So anyway, you can continue and tell us about, how you open the gates and how you can help.
Yeah. I think it's the open the gates, can help you get the pain reduce, and some people is getting totally fully completely pain is disappear and make you leg strong. And if you open these gates, usually I use the 1 time, 2 times, 3 times, already get good results. Use it after the more treatment, you can get recover. After getting recover, should be keep gets open. Don't damage. I will be tell you how to keep get open. And also I will should be suggestion after you getting recover, everything normal. I would like suggestion after 3 months, 6 months, or 1 year, should be come back the diagnosis and check up again. That I call tune-up, total body tune-up for your gates. Keep open.
So in order for someone, when you've diagnosed the problem and you begin to open the gates, they need to come back to you 2 or 3 times to keep the gates open.
Right, that's true, that's true.
Amazing. I think it's brilliant.
Yeah, so I would like is the help. I use this the gate open. I call the Colgate medicine.
What
That
do you
means
call it? Could you say that again?
Colgate medicine. That means Colgate is called C-O-R-E. Gate is G-A-T-E. Colgate medicine.
Closed gate medicine.
Yeah, Colgate medicine. Colgate medicine after open, you can wake up your body, strong energy, also universal energy, earth energy come into your body. If you lower gates close, all that energy, a lot of energy in there, all that. The flower and the trees and the sun, energy cannot into your body because you get close. After open, you get the sun's energy a lot. Flower, trees, and every kind energy, positive energy into your body. If you get close, cannot into your body. Also, some bad qi, bad energy into your body appear. And the more your body inside make you sick, going to worse and worse. So open gates is very important for your health and life.
Would you recommend that even if a person does not have pain, that they should check their gates periodically to make sure that they're open as you get older?
Yes, of course, if you somebody interested want me give the checkup, I can do free checkup. I would like say I can use 3 minutes. I check your tongues, according to Chinese medicine, check your tongues, pulse, and touch your gates. Within 3 minutes, I can let you know why you problem, why you are energy weak. I can immediately, clearly let you know.
May I interrupt you to repeat that? Dr. Wang just said that if you go to see him within 3 minutes after checking your tongue, your pulse, and your lower gate, he can give you a complete evaluation on what is wrong in your body and how they can fix it. Is that correct?
Yeah, that's true. That's true. That's why it's the Jenny, I would like in coming Sunday, 2 o'clock to 4 o'clock, and September 13, afternoon 2 o'clock to 4 o'clock, I have the event seminar. That means how to make you stronger body, lose your pain, reduce your pain, and like this kind of event. If somebody interested in, very welcome, come here, join us this event.
Okay.
I would like check service for them, free.
We are out of time, and I'm going to wrap this show up by telling anybody watching this segment that on September 13th, Dr. Wang is having an open house at the Chinese East-West University Medicine establishment where he works from 2 to 4. You're welcome to go and to listen to some seminars and get a free evaluation.
Yes.
And get a free evaluation, and he can take a look and let you know which of your gates are open or if you need anything done.
Right, you're right.
And you can do this by calling 408
408-733-1878. 408
733-48.
No, 408-733-1878.
Okay, so 408-773-1878.
No, 408-733-1878.
Okay, 733-1878.
That too.
Okay.
That too.
And so please feel free to call the school and get any more details you need, but I encourage you to go see Dr. Wang. If you're having problems with your teeth, with your sleep, with sciatica, with back pain, with intestinal pain, he can help you with them all. And I thank you, Dr. Wang. And I thank you all.
Sure.
Sure. And I thank you all for watching this show. My goal is when something works for me to share it with you so that we all can enjoy a happy, healthy life, especially during this time of the pandemic. So once again, thank you for watching Conversations with Jennylyn. When a conversation is all we need to get the facts to become better people. And I will see you next time.